Therefore, I understand you want me to share the colleagues. So I think, first of all, as an executive director, I'm getting a lot of positive feedback. And I'm not saying because they're here. This is, I'm saying, what I'm getting from other doctors. They have a very good relationship. They are always there to assist us. Okay. Sometimes they stay late in the night to help our patients, but also to train our colleagues. So we've been getting doctors from China from time to time. We are getting a very good cooperation with them. I have never get any complaint from our doctors from China. They're always in time. They help us a lot in terms of patient care. Sometimes they even stay long time. For example, we stay a long time helping patients. Sometimes at night, anytime they come and help us. So really, we are getting a very good cooperation with the doctors. And of course, they will also mention this. I'm hoping also our doctors, they are also giving them. So we are staying like one family. I don't always see. I'm also learning to speak in China. Under my leadership, we have started expanding. Now we are planning to have a project in the western zone of Tanzania, in the main hospital called Chato Hospital Geita. So that will be another branch of Jakaya Kikwete, which will catch all the western zone. As you know, the bigger population in Tanzania are in western zone. So there's a lot of demand in western zones. We have started the projects. We are doing an outreach program every month. Our doctors are visiting there. Actually, we are also planning, maybe we can also go there and see Chato Hospital, where we are going to extend. We are also going to extend to northern parts of Tanzania. In Arusha, we are going to establish a clinic there in Arusha, but also with the collaboration with the Arusha International Conference Center, AACC, we're going to build another center in Arusha, which will also cover the northern part of Tanzania. But we also started doing an outreach program, and the main aim of this outreach program is to build capacity to local hospitals in the regional referral hospital. So we normally visit every month in those areas. So we are screening patients, we are giving health educations, but again we are training local doctors how to manage cardiovascular disease. For example, ECG interpretations. We are training them to manage basically cardiovascular disease like hypertension, heart failure, arrhythmias. So up to now we have visited almost 16 regions, and more than 14 people have been seen by our center. So this is now what I say, we are expanding a lot. We want now to use our technology to help our patients. For example, one of the telemedicine, so that we can operate a patient here while we get an advice from China. So that's number one. So we get to transfer the technology from China to come here. So especially in the complicated cases, for example, we are using a lot of money to send patients to India for complex procedures. So we want them to help us so that our doctor now can perform complex procedure, because the other basic procedure we can do ourselves. But now we want to advance. So this center be one of the leading centers in Africa to manage cardiovascular. So we need their support to help us. So we've already received support from construction for another building, but now we need education and education and education. So we need them to support us on the education, so that we get many more doctors in Tanzania, so that we can, other doctors can go all the region. We need every region to have cardiologists. We need every region to have cardiac surgeons, So that, because if you get a heart attack today, you are staying in Mwanza, it will take several hours to come here in Tanzania. But if you have another doctor in Mwanza who will also manage heart attack there, that will be best for our population. We are still enjoying this relationship, and we want this to stay forever. We want this relationship between Tanzania and China to stay forever, so that we can expand. And Tanzania being one of the best countries, we are also going to transmit this to other countries. For example, it's because of this good relationship between Tanzania and China. Now we are helping Zambia and Rwanda to build a sustainable cardiac program. We want this to expand in all African countries. So one of my KPI, I say, we cannot just only save Tanzania. We need also to save other people in Africa. So we use our doctors. Recently we'll be going to Zambia to teach them. We have started teaching Zambia. Once we finish Zambia, we'll move to other countries. And eventually all African countries, they will have the best cardiac program. But what is the root cause? Is the root cause between bilateral relationship, a good relationship between Tanzania and China.
This is the second time I come to Jkci. So I like working here. I like working with local doctors and teach the local doctors how to do pediatric interventional procedure. That's why I come back again. I spent 2 years here, 5 years ago. I working here. When I first come here, the local pediatric doctor can't do interventional procedure. After I come back, we work together and started congenital heart disease procedure without opening heart. We did a less invasive procedure. So I built a good relationship with local colleagues. When I was leaving, the local doctor, including Dr. Janadi, asked me to extension. Yeah, so when I was in China, I missed here very much. So I applied another 2 years term. Yeah. That's my story. Okay. So